Dr. Tracy Page, and welcome to Health Made Easy, where we discuss topics focused on hormonal health, weight loss, and wellness. Yes, you heard me. I want to make being healthier easier. Don't get me wrong, we all have to do the work, myself included, but let's make being healthy less complicated. I'll provide clear, simple, and actionable steps that you can implement into your daily life. Really, who doesn't want to feel better? If you're ready to increase your energy, optimize your well-being, and restore your health, then listen up. I love helping my patients and listeners optimize their health and clear away the brain fog, shed the excess weight, improve their mood, and really change the way they age. I am a triple board certified physician, and I created Health Made Easy just for you. Let's get started on today's topic. Welcome. This is episode number 12. I'm Dr. Tracy Page, and I want to talk to you about fatigue, weight gain, foggy thinking, and how all of this may be related to your thyroid. You know, we are going to cover a lot of different things today when it comes to your thyroid. Where and what your thyroid gland is and what it does, why and how your thyroid can stop working, different types of thyroid disorders, and the signs and symptoms of an underactive or even an overactive thyroid, and then what tests you should have completed to evaluate your thyroid and your treatment options. So we have a lot to cover, and this is a very important topic. It comes up a lot in my practice for my patients, and it even came up for me. And I had no idea that my thyroid wasn't working when I was diagnosed with hypothyroidism, but it affected my life in ways that I didn't even realize. And you may identify with some of these yourself. So we're going to get started, and I want to talk to you about the thyroid gland. It's a butterfly-shaped organ, and it's at the base of your neck, and it releases hormones that help regulate your metabolism. And our metabolism, as we all know, is how our body uses energy. So it's how our body functions to use energy, and it's breathing, your heart, your bones, your body weight, all of those things are affected by your thyroid. It can also affect your ability to become pregnant. It can affect your ability to concentrate and to have a good memory. It can affect your ability to lose weight. So the thyroid gland has a lot of purposes and roles in the body. So how the thyroid works, it's in relationship to the pituitary gland that's in the brain, and also the hypothalamus. It's a region of the brain. So the hypothalamus will release what's called thyroid-releasing hormone, which stimulates the pituitary, then another region in the brain, to release thyroid-stimulating hormone. So there's TRH and TSH. And that in turn stimulates the thyroid gland, the little gland in our neck, to make T4 and T3 thyroid hormones. There's a feedback loop between the thyroid hormones so that when we make a certain amount of thyroid hormones, it goes back to the brain and says we have enough hormone in the blood. So therefore TRH and then TSH stops getting released in the brain. So it's a constant feedback loop. So if your thyroid hormones are high, then you have low release of TRH and TSH. If your thyroid hormones are low, it sends a message to your brain that, hey, we need some thyroid hormones. Now, what's interesting is that actually T4, thyroxine, gets converted to T3. And we'll talk about that more and why that sometimes doesn't get checked, but it's a really important concept here. So what affects or causes the thyroid to have problems? So what kind of things affect the thyroid and what causes problems? So a lot of times it's in our environment, how we eat, our stress level, pollutants in the air or in the foods that we eat. These can all very dramatically and drastically change what our thyroid does and how it responds. And this is why you can have a healthy thyroid and then later develop hypothyroidism. So let's talk about some of the most common causes of low and high thyroid, autoimmune thyroid conditions, and then some of the other things that can cause. So when your thyroid starts acting up, you can get hypo, which is a low thyroid, not working very well. The thyroid is sluggish. Or you can get hyperthyroidism, where the thyroid overworks too much and creates too much thyroid hormone. You can have where the thyroid gets attacked by the body. It's called an autoimmune thyroid condition. And then you can have nutrient deficiencies. So you can have a lack of iron or zinc or selenium. You can have a lack of vitamin E or B vitamins. You can have high or low levels of iodine, and all of those things can affect your thyroid. You can have, like I said, high stress levels. So when cortisol is high, that stress hormone can suppress the release of TSH. So then you stop releasing TSH and your body stops making thyroid hormone. And you could have heavy metals in your body that you're unaware of, which could cause you not to make thyroid. You could have a gluten intolerance. I'm going to do a whole separate podcast on gluten sensitivity. But a lot of times, especially in my autoimmune patients, if we get gluten out of their diet, their antibodies in their thyroid come down, they stop attacking their own thyroid, and their thyroid numbers come back and look much normal. You can have infections like a EBV, which is Epstein-Barr infection, or Yersinia infection that can cause you to have thyroid problems. You can have radiation or surgery in the area that can cause a thyroid problem. You can have a family history of hypothyroidism, which we see a lot. And you can have an inability to convert T4 to T3. And I see this quite often where patients don't convert T4 to T3, so their T3 level is very low. And things that can cause you not to be able to convert T4 to T3, and let me clarify. So they're both T4 and both T3 are hormones. They both are thyroid hormones, but T3 is 4 times more active than T4. And I kind of think of it as we have inactive T3 and active T3. The inactive is called reverse T3. So think of them as twins. They both go to school. They both have a desk. They both sit at the desk. That's the receptor. So they both have a spot on the receptor in the cell that uses thyroid hormone. And one of the twins produces energy. So they produce work. They produce, right? And the other one sits at the desk and even though it sits on the receptor, it produces nothing. So that's how I like to explain it to my patients is that you can be making a lot of T3, but you could be making reverse T3, which sits on the receptor and produces nothing. So it might look like your thyroid numbers are normal, but you have all the symptoms clinically of hypothyroidism. So why don't you convert T4 to T3? So age, as you get older, too much alcohol intake, diabetes, too much fluoride intake, lead intake, mercury, so those heavy metals. If you're overweight or obesity can prevent T4 being converted to T3. Pesticides, radiation, stress, surgery, lithium, too much iodine, too much estrogen. So I see this a lot in my estrogen dominant females that develop hypothyroidism because estrogen is very inflammatory to the thyroid. So they have too much estrogen. If they're on birth control pills or beta blockers, which are medications that patients are on quite often, steroids, all of those things can prevent you from converting T4 to T3. Also, I mentioned nutrient deficiencies. So again, chromium, copper, iodine, iron, selenium, zinc, vitamin A, vitamin B2, vitamin B6, and B12. If any of those are deficient, they can prevent you from making thyroid hormone and converting T4 to T3. Okay, so we talked about some of the common causes. Let's talk about the different types of thyroid disorders. So there is hypothyroidism, like I mentioned earlier, which means your thyroid is not making enough crucial thyroid hormones. It's more common to be hypothyroid than to be hyperthyroid. And most of the time it goes unnoticed. So hypothyroidism slows body functions down. It slows your metabolism down, your heart rate down. It can lead to weight gain. You know, a lot of the typical symptoms that my patients will present with are brittle nails, cold hands and feet, cold intolerance, constipation, depression, difficulty swallowing, dry skin. They can have elevated cholesterol levels, elevated blood pressure. They will get some fatigue. They'll have hair loss. Their voice will get very hoarse. They can have low blood pressure. They won't be able to concentrate. They can be infertile, inability to get pregnant. They can be irritable, have menstrual irregularities, muscle cramps, muscle weakness, nervousness, poor memory, puffy eyes. Their heartbeat, like I was saying, could be slow. They could have weight gain. So I see so many patients who come in who have a lot of these symptoms. And so I always want to check their thyroid to make sure their thyroid's working properly because when it's not, then it's like trying to, especially for my patients who are trying to lose weight, it's like trying to go uphill and carry like a 90-pound boulder along the way. Like it's just impossible. It makes it feel impossible. And especially the mental fog and confusion in memory, I see that a lot too. And it could be something as simple as they have a sluggish thyroid, like their thyroid isn't working. Cold intolerance, brittle nails, loss of hair. So I see these a lot. And so again, always check the thyroid to make sure you're not missing something that can be easily treated when patients present. Now, the opposite to hypothyroidism is hyperthyroidism. So that means the thyroid is making too much thyroid hormone and it speeds up the body functions. So your metabolism goes fast, your heart rate goes fast. It can lead to weight loss, but it's not good. So sometimes I see patients come in, and this even happened to myself where my medication was dosed that would put me into hyperthyroidism. And that's not good either because that can cause you to lose calcium from your bones. It can cause your heart to have a beat too fast. You could get arrhythmia. So you don't want to be in hyperthyroidism. And actually, I've seen patients in hyperthyroidism who felt really fatigued as well. So it's not like it's good because it makes you lose weight. Sometimes I have patients come in, they're like, oh, I definitely need to have more thyroid medication. And I try to explain to them that that's not a good thing either, that there are side effects from too much thyroid medication. So when you have hyperthyroidism not caused by medication, it can cause fatigue, a goiter, which is, your neck will be very thick and full, heat intolerance, high blood pressure. You can have nervousness, heart palpitations, sweatiness, tremor, weakness, and weight loss when you're hyperthyroid. And then there's the autoimmune conditions that cause thyroid disease. So there's Hashimoto's, which is an inflammatory condition of the thyroid gland. Initially presents as hyperthyroidism, but over time will present as hypothyroid condition. So it involves antibodies that attack the thyroid gland, and then the thyroid gland doesn't function appropriately. It is the most common cause of hypothyroidism, and it affects about 5 out of every 100 people. Pretty amazing. And again, it's more common in women than in men. The other one is Graves' disease. So it's the opposite of hypothyroidism. And this is when you have hyperthyroid condition. And you'll see patients who have Graves' disease, their eyes will protrude. So they'll have protruding eyes, and they'll have abnormal nerve sensations such as tingling or buzzing in their extremities. Again, this is too an autoimmune condition. It involves the overactive thyroid gland, and the immune system is attacking the thyroid gland, but it's causing it to make more thyroid hormone than the body really needs. Okay, so it's not good to have hypo or hyperthyroidism. I always tell patients, like anything in life, it's good to be balanced. This podcast is brought to you by Orthomolecular Products, the exclusive supplement company of the Wisconsin Institute of Functional Medicine. I have chosen Orthomolecular because they are a leader and an innovator in the functional medicine space since it was founded over 31 years ago. They follow the latest science and combine the highest quality of ingredients to produce effective nutritional solutions for clinicians like myself to use with my patient. They control the entire manufacturing process. They know exactly what is in each capsule, and they offer products free of allergenic additives and preservatives. This is just one of the many reasons I decided to carry Orthomolecular products in my office. You can book an appointment today to learn about how my team and our partners at Orthomolecular can help you reach your health goals when nutraceuticals are needed. You can call us at 920-968-9311 or visit us on our website at wisconsinfunctionalmed.com. It's all one word, wisconsinfunctionalmed.com. We use Orthomolecular products because efficacy and your health really matter. So what should you be looking for? So I've already mentioned a lot of things. So weight gain or weight loss, fatigue, mood changes, irregular heart rhythms, shortness of breath, swelling in your legs or your face, especially under your eyes or in your eyelids, yellow or orange tint to your skin. So when the thyroid isn't functioning properly, your body, it's interesting, it can't convert beta carotene into vitamin A. So your skin looks more orangey or yellow tint to it. So you'll notice this, especially you can see this in patients. Heavy or prolonged periods, muscle weakness, digestive issues. So again, if they're constipated, they're going to have digestive issues. And if they're hyperthyroid, they're going to be pooping a lot or have a lot of bowel movements. Other signs of an underactive thyroid. So the thyroid hypothyroidism, you feel cold, joint and muscle pain, thinning hair, dry skin, a hoarse voice. Other signs of overactive thyroid, again, feeling hot, increased sweating, and those bulging eyes. So you'll see the white of their eyes above and below their iris. So, what tests should you have completed if you want your thyroid evaluated? Now, there's a lot of controversy, I'll just say it right out there, about thyroid testing. And before I did board certification in functional medicine, before I did the master's program in integrated medicine, I should say the graduate program in integrated medicine, I only tested T4 and TSH. And that's what your typical doctor will test. But I believe, and now that I've studied it and seen it in my own patients, I test everything now. I test TSH, free T4, free T3, reverse T3, antibodies, TPO antibodies, and antithyroglobulin antibodies. And then I look for nutrient deficiencies. So I look for selenium and iodine and iron and the B2, 6, and 12, and vitamin A. And I look for all those things because we know that when patients have those nutrient deficiencies, they're also going to have increased risk of having hypothyroidism. So I think the reason to do all the tests is to give a really bigger picture into what's going on with the thyroid. It's important always when we talk to our patients that we talk to them about what are the underlying problems, because there's other things that can cause thyroid conditions. For example, we talked about the heavy metal exposure, the nutrient deficiencies, having high stress, which leads to high cortisol, inflammation, elevated blood sugar. So you have to look at their lifestyle too. You don't want to just give a medication. You want to figure out why the thyroid isn't functioning correctly. So I always tell my patients treatment doesn't start always with the medication if they have hypo or hyperthyroidism. Now, typically with hyperthyroidism, you have to be careful. You don't want them, heart palpitations and muscle weakness and fatigue. So, but you don't always want to start with the medication. You want to think about the thyroid as an organ, but you also want to think about it as a system. So you need to look at the whole body. So for instance, what is their inflammation level like? So I always talk to my patients about their inflammation level. And I always check a CRP because the best way to bring down inflammation is to stop eating chemicals. And so often we eat chemicals in our everyday food, they sneak in. We don't really take time to read the ingredients or the labels. And so I always tell my patients, if you can't pronounce it, it probably isn't good for you. You want to watch for dyes and additives in your food and avoid inflammatory oils like corn oil, vegetable oil, canola oil. Some of those oils can be very inflammatory to the body. The other thing that can affect the thyroid is you could have high blood sugar. So one way that I work with my patients is I get them to lower their blood sugar, to eat lower glycemic foods. I get them to think about a lower carbohydrate diet, because then what will happen is their blood sugar will go down. It will cause their liver to produce ketones, and then their pituitary automatically will secrete TSH, which will tell the thyroid to secrete T4, and then you'll convert T4 into T3 in your liver and your gut. So that's really important because we want to talk about the liver and the gut. A lot of times if you fix the gut health and you fix the liver health, then the thyroid works properly because, again, you convert T4 to T3 in those two places. So I'm also always talking to my patients about gut health and about liver health. And as a matter of fact, I'm getting ready to do a 7-day detox through Orthomolecular. They have a product called Core Restore, and they have it in a 7 or 14-day detox. And I'm super excited. I'm actually going to take some photos and post them for you guys. And I'm going to do a podcast on my experience with the detox and explain about detox. But we have different phases of detoxification in the liver. We have phase 1 and phase 2. And there are a lot of nutrients that we need in order to undergo detoxification. Our B vitamins, glutathione, C vitamins, methionine, so magnesium, glutamine. I mean, the list goes on. And this isn't going to be a detox talk, but I'm going to give you one. So I'm going to do this. It's by, again, Orthomolecular. I'm going to do the 7-day core restore detox. And basically, it's a shake in the morning, a shake at night. And then there are a couple of products that go with it. And then it's a really nice thing. They also give you a nice little booklet and handout on things to add into your diet during that time that help detoxification. So remember, the liver is important for so many different reasons, but one of the reasons of the things that we're talking about today is thyroid. So, this is a great way to make sure that it's not your liver or your gut, because this is great gut health that we're going to be talking about too with the Core Restore program, is that you can restore the gut, you can restore the liver and detoxification, and then a lot of times thyroid starts working appropriately. The other thing too is stress. So it always comes back to stress, but cortisol, when it's elevated, it shuts down your pituitary, that decreases TSH, and then you don't make your thyroid hormones. So always remember, even when you're thinking about thyroid, you want to think about meditation, relaxation, yoga, or something as simple as sleep, just to really get your levels under control. So medication is always an option, and sometimes medications need to be used, but they're not always the first option. And that's important. I want you to make sure that you hear that message, is that they're not always the first option. There are medications. Synthroid is the one most patients know about or have been prescribed, and that contains T4. It's called levothyroxine. But there's other medications or combination medications that contain T4 and T3, like Armour Thyroid, Nature Thyroid. There's ones that contain just T3. And I usually don't prescribe just those. I usually prescribe a combo of T4, T3, because I see patients get really good results with that. And again, you want to give the least amount of thyroid medication to get the patient normalized. So there is a ratio that you want to check. And you always want to remember that when you're doing a combination of T4, T3, remember T3 is more active than T4. The other thing too is you want to balance all hormones. So I always tell my patients, you want to make sure your DHEA, which is made in the adrenals, testosterone, progesterone, estrogen, and pregnenolone, those levels are normal and balanced as well, because they do affect the thyroid. So other things to consider is eat a balanced, healthy diet. Again, clear out any body of metals and toxins, correct any iodine deficiency, that's a big one. And then gluten sensitivity is also a very big one. And I will tell you too, is I see a lot of patients that when they give up dairy, their thyroid works better. Now, I'm not saying everyone has to give up dairy, and I live in Wisconsin. We're known for cheese. So I'm not saying you have to give up dairy, but especially my patients who have elevated antibodies, when the antibodies are elevated, I find that if they eliminate dairy and gluten from their diet, they tend to feel a lot better. So it's really patient specific, but I do want to throw that out there. So remember, when you think about your thyroid, it is an organ, but it's also part of a big system that includes your gut and your liver, and also how you manage your stress. Those are all really important, and keep them in mind because they will make a difference on how you do and how you feel. And also that last one, inflammation. So making sure your doctor is checking your CRP and making sure that you don't have high inflammation. So I hope this information helps. If you have any of those symptoms that I described, make sure you talk with your doctor and make sure you get your TSH, your T4, your free T3, your free T4, and your reverse T3, as well as your antibodies checked, because it will give you the big picture and will help you understand what's going on. So I wish you all health and happiness. Remember, you can change the way you age, and all you have to do is show up, live healthy, live well. And we just got some photos of our new office. It's working on being completed. And I love one of the photos because it really speaks to what I try to teach my patients always, which is eat well, move daily, hydrate often, sleep lots, and love your body. You have this amazing body. It can do so much for you. You can change the way that it ages. It's all in your power. It's all how you want to approach it. And we're here to help you. We want to teach you. We want to help you age well and get the most out of life. And that's really our mission. So I hope this podcast was helpful, and reach out if you have any questions. You can go to info@wisconsinfunctionalmed.com and send us a message. Again, info@wisconsinfunctionalmed.com and drop us a note and we'll be happy to help. Okay? Take care. This is an important reminder. The podcast is for educational purposes only and is not a diagnosis or a prescription for care. Please consult with your healthcare practitioner before moving forward with any of the therapies or treatments discussed in today's podcast. If today's topic resonated with you and you want more information, please check out our website, wisconsinfunctionalmed.com. All one word, wisconsinfunctionalmed.com. Also, for those of you who want further assistance with weight loss, consider our online weight loss program called The Pause, which can be found under Services. We really focus on helping you reach your weight loss goals. We provide a supportive and interactive and engaging environment, which is led by me, Dr. Tracy Page, so you can get all the help you need. Remember, you can change the way you age, and I'm here to help.